My favorite part about the nurse residency program was the interdisciplinary shadowing that we got to be a part of.
My favorite shadowing experience was definitely in the IV room.
I really enjoyed following pediatric palliative care.
I specifically went with 4 different groups, but my favorite was the palliative care team.
I got to talk to my heroes. I've always known that I want to go on one day and get my master's and be a nurse practitioner. But by shadowing the supportive care team and shadowing the pain team, I got to see that in action.
On my unit, I don't always get the time to talk to respiratory therapists or ostomy nurses or PIC nurses or even stat nurses because they're usually trying to accomplish their goals.
I enjoyed being able to remove myself from my regular duties as a nurse, just to really focus on what they're doing.
So it's nice to get a part of the day to just spend with them and hear exactly about what they do and how they can help my role as an RN and how we can use each other to provide better care.
It's just really nice to see how other people work throughout the hospital.
You see their role from a different perspective than what I typically see on a day-to-day basis. You see how important their job is.
And then to know how busy they really are makes me able to realize that if I don't have a med right at 9 a.m., they are super busy down there.
There are different dressings that we don't have down in the emergency department, but that I can call materials and ask for, things that, they said, hey, this is a better idea, do this, when you first get the patient, that makes it a little bit easier on the nurses upstairs.
They kind of walk you through everything, what's important, what they look for, and there's actually a reason behind everything that they do.
Not giving insulin for our pediatric patients that we get on our floor because sometimes they'll get their insulin and then they won't want to eat the tray that they have, and they kind of use that as their own way to get certain foods that they want. So they were able to give us a heads up about that.
So now I know that if I have a patient who's complaining of pain and I can't get it under control with anything, then I can maybe reference the pain management team. They can come and talk with the patient and see if they can help.
It gave you the courage, I guess, to, talk to a doctor and say, the patient is kind of leaning towards not wanting these things. They don't want this feeding tube. They don't want to go through this anymore, and I don't think anybody's said to them, you don't have to do this. I think that it was awesome working alongside them for a couple hours because it gave you the confidence to advocate for your patient more.
Today I walked into a patient's room and I seen someone who I followed on the diabetes education team. And it was just nice to know, oh, that's who she is and that's what she's doing with my patient.
And now because of that, I know who I can turn to with questions and consults to help give better care.
It's a smoother transition for the patient with the doctors, with the nursing, with the patient, with the family, because everybody's involved in that process.
And it was wonderful just getting to experience that.
It really ignited a fire under me to keep working so I can reach my goals later. It was awesome.